So I was telling the hygienist that the last couple of days I've noticed severe aching and throbbing on the lower left side of my mouth.
Okay. Tell me this, can you tell which tooth, or is it difficult to identify?
It's a little difficult to identify, but I definitely think it's one of the molars on the lower left.
Okay. I was looking over your records. There was a very deep filling done a few years back, and the tooth was a little weak. It might be a little cracked. There might be some other things causing that. What we'll do is we'll take a couple x-rays and check it out. If it's waking you up at night, that's not a good sign. The good news is we can fix it most of the time.
Okay.
One of the things that we do, and I call the R word, root canals. For instance, every tooth has a nerve inside of it, kind of like the ink in this pen.
Okay.
You basically take the ink cartridge out of this pen, and then you sterilize it and cork it back up.
All right.
And that way the infection that's in your tooth goes away, the pain goes away, but you get to keep your tooth. And after the root canal's over, we always want to strengthen the tooth with a crown. What we want is to be infection-free, pain-free, and strong so that it can last for many, many years.
Okay, and it won't hurt when I get the root canal done?
No, you're going to be completely numb. You won't feel anything.
How long on average does a root canal typically take? I've heard you can be in the office all day long and I'll have to take off work all day.
We do most of the root canals here in this office. There are exceptions where there's a very tricky case. We'll send you to a specialist, an endodontist. Most of the other ones we do here. And I would say 45 minutes, maybe something like that, depending on how many roots the tooth has. It's not too bad. It's kind of like getting a filling. You sit there, you're numb, you don't feel anything. It's kind of boring, actually.
Yeah. I like to hear boring.
That's right.